So with that, I'm going to welcome our first group up here today that is going to be led by Crystal Day. And this presentation is going to focus on evidence-based strategies for promoting safety and mental and physical well-being.
Thank you, Darren. So our panel today, Best Practices in Health and Wellness for the Public Safety Workforce, will be presented by Bill Hollingshead, Julia Brenton, Merritt Hoffer, Aaron Black, and Lance Miller. I will go ahead and invite Chief Hollingshead to the mic. If you would like to learn more about their bios, there is a QR code at the end of the agenda. Please scan that and you can learn more about their backgrounds.
Good morning. I think this does work, correct? Great. Appreciate the opportunity on behalf of police chiefs across our state. We appreciate the opportunity to be here to be able to present and also for our partnership with RTI. I think we first started really partnering with RTI probably a decade ago. The opioid crisis was mentioned. That was first and foremost in a lot of our minds as far as issues, crisis events or crisis incidents that really affected our profession. So we've appreciated the partnership through the years. That opioid crisis obviously has not stopped. It's just kind of changed into now fentanyl, but we were talking earlier in the hall with some people about what are some of the critical issues in law enforcement. And of course, opioid and fentanyl deaths is right there at the top. I've told people that cops do not want to go and zip young people in black bags anymore. That is what we're doing far too often. So the fentanyl crisis, the opioid crisis is still an issue that's right there at the top. It's hard to look at a news report or open a newspaper and see another crisis situation that's occurring in law enforcement today. And it was talked briefly about here, and that is recruiting and retention. Right now, we are finding it very, very difficult to attract qualified applicants to come into this profession. There's a number of reasons for that. We could talk for a day just on that. But in addition to recruiting and attracting qualified applicants is what about keeping the good people we've got? And that has been extremely difficult in the last 3.5 to 4 years. We see an awful lot of people leaving the profession. So mental health, wellness, physical health, that goes along with how we are keeping our cops in the profession. So in terms of wellness, we as police chiefs realize that we have got to do better. We talked about ways to improve, always wanting to improve what we're doing and that we're maintaining best practices in that area. Cops are not researchers. That's why when we think of policies, when we think of programming, we appreciate what RTI does to make sure that we are still maintaining those best practices. But when the public needs help, they generally call the police. Well, who do the police call when they need help? And that's something that we as police chiefs are really stressing right now to making sure that we provide that assistance to our cops out here on the street to help keep them here in the profession. So when we think about officer wellness, there's obviously mental health wellness. That's very, very high on our list. Physical wellness and health. We mentioned physical fitness programming, stress awareness, officer safety. We're going to hear a lot on body armor and ballistic vests to keep our cops safe, and financial wellness. Cops aren't immune from having money problems, and that just adds to the stressors. But when we started looking at this topic, we don't know what we don't know. So we look across the country as far as what are some of those critical issues and trends that when we are interviewing our cops or interviewing prospective cops, what is keeping you from the profession? But right now, one of those critical issues, again, is that staffing. It's at critical levels. The Police Executive Research Forum, or PERF, did a study in 2020, and it says that the hiring of qualified officers has decreased since 2020 by over 25%. That means we're not finding the candidates that we want to be police officers wanting to enter the profession. Our early retirements have increased by 31% in the past several years. Our resignations, officer resignations have increased nearly 43% in the past 2 years. we got 43% more cops leaving the profession than we had before 2020. What can we do to stop that? A lot of people think, well, we need to widen the net. If we're not getting the people we want, or we're not getting the numbers that we want, why don't we widen the net? Has anybody seen what Philadelphia PD did in the past month as far as hiring? They said, well, if we can't get the people we want, we're going to lower the standards. We're no longer going to require physical fitness standards to be police officers in Philadelphia. Is that a good idea? There's been conversations in our state about widening that net. So maybe we need to lower the standards. Maybe certain felonies would be okay to be police officers. Maybe hard drug use would be okay to be police officers. I see the cops up front saying this. We feel the same way as chiefs. You know, we want to increase that level of professionalism, not decrease the level of professionalism in policing. The changing public sentiment towards the police. Obviously, since 2020, we've been faced with changing public sentiment. You know, and a lot of it, if you talk to police officers, they feel like a lot of that is fueled by the media. We have a police chief here in our state who was the police chief in Ferguson immediately following the Ferguson incident several years ago. And does everybody remember what the media kept telling the public was, hands up, don't shoot? Remember, that was the narrative that was kind of set. We knew that didn't happen. The person that made that claim recanted the very next morning, but the narrative was already set. So it just exacerbates maybe that negative public sentiment that officers are looking at each and every day. The increase in level of threats of violence in policing and in society today, when we're looking at these numbers, ambush attacks against law enforcement is increasing across the country. Repeat offenders and a lack of accountability in the criminal justice system. Does anybody know Chief C.J. Davis? Used to be in Durham. She's now in Memphis. Everybody saw what happened with her agency just a couple days ago. She had 3 police officers shot, 1 killed by an individual that had dozens of arrests. They had arrested the week before on 5 felonies, including an automatic weapons charge, released on no bond. I talked to her on Monday. We've got to look at that and say, is that best practices? We've tried that. Is that still best practices? Are we keeping our communities and our cops safe? Operational vulnerabilities within our agencies. We talked earlier about mentioned officer suicides. Mr. Miller and I were talking earlier this morning. We have almost twice as much number of police officers committing suicide each year than we have dying in the line of duty each year. We've got to stop and look at what is making our cops reach that point. And a lot of that is lack of support. We've got an awful lot of agencies across our state and across the country that we just don't provide the support we need for our police officers. So when we take what's occurring across the country, and then when we look at what are we seeing in North Carolina, the North Carolina the Chiefs of Police Association partnered with DPS. And I see the Deputy Secretary of DPS, Sherry Hunter, in the audience today. Thank you very much for being here. DPS is a great partner, and I hope she will agree with that. We do an awful lot of things with DPS, and it helps that the Secretary is a retired police chief. So we appreciate the support of DPS. But we worked with them and the United States Marshals Service to conduct a survey across North Carolina to look at some of those issues that are causing our cops to leave. And what are the stressors that are facing our cops here in North Carolina? I know that those numbers off to the side are really hard to read, but I've kind of highlighted the main ones. Responding to critical incidents. Obviously, a police officer, a deputy sheriff in their career responds to thousands and thousands of calls involving things that nobody wants to respond to. The violence, the domestic violence, the child abuse, the sex offense cases, especially those involving children, the human trafficking now that we're seeing more and more of violence toward the public, violence toward themselves as police officers, working homicide cases, especially those involving children. I started my career in 1984. I remember the very first infant death that I worked. I had to attend the autopsy there. I still remember that child there during the autopsy 40 years later. So those incidents stay with an officer through the career. And when we talk about issues of stressors and PTSD and that kind of thing, We look at, is it just one event? Is it maybe a shooting that they were involved with, or a particularly heinous act or crime that they've had to respond to? Or can it be an accumulation of events through the years? And if you got a 20 or 25-year cop that comes to you and says, I've got some issues, is that a PTSD issue that we're going to be able to help them with in the state of North Carolina? We'll talk about that a little bit more. Negative media about the profession, we've talked about that, but Pew Research has done lots of studies on that, on how the negative stories day after day after day after day affects police officers and their willingness to do the job. Officials outside the profession just don't understand what I deal with. Low morale due to the CJ system. We've talked about that. Negative attitude from the public towards the profession. Those of you wearing the badge and the gun, have you seen a change in the last 4 years? Maybe the way the public reacts to you. And that's been an issue here in our state for a little while now. One of the biggest issues that's a big stressor is staffing shortages. You know, we've got cops that are having to work day after day after day without a day off. And does that affect their mental health? Does that affect their physical health? Absolutely. Again, Department of Public Safety here in our state, their Justice Analysis Center they released a report on February 5th of this year, just about a month and a half ago. It says that nearly 60% of law enforcement agencies in North Carolina report that their vacancy rate has increased since 2019. 80% report it is more challenging to find qualified candidates and to retain good people. And 25% of the agencies in North Carolina, a quarter of our agencies, have at least a 25% vacancy rate. So does that affect staffing? Does that affect the ability of your police to respond to calls for service? A department here in North Carolina about 2 years ago released a news report that says we will not respond to these 21 calls for service because we don't have the people to respond. Assaults in progress, trespassing, larcenies in progress. Those calls, we don't have the people to respond. But if you'd like to go to our computer and fill out a report, we'll look into it. Okay. Does staffing affect you as a citizen? Absolutely. And it certainly affects our police officers. There's a statistic in the DPS report that I thought was concerning. It says that only 17% of police chiefs in North Carolina would recommend this profession to a family member or a friend. You know, as a 40-year cop and somebody as a son of a cop, that's very concerning to me that we have gotten to the point, even as chiefs, sheriffs, and veteran officers are saying, you know what, you don't want to come into this profession. Used to be very proud to say my son or my daughter followed me in this profession. We're losing that now. Stressors in their personal life, lack of sleep, financial worries, or a lack of money, lack of time with spouse and family, lack of time for personal life tasks, lack of time for recreational activities, lack of time with friends, and grief or loss. What's the common denominator in all those things? The lack of. Okay. And it all revolves around back to that staffing issue. We just don't have time. And then it may roll into that financial worry. When I do have time off, what am I doing? Working an extra job, right? Because I've got to make the ends meet. I've got to pay the bills. So that lack of, when we, as chiefs, we've got to find a way to give our cops the time off that they need. I was talking to somebody from RTI last week, and she said that she was interviewing some detectives at an agency here in North Carolina. And they were stating to her that they do not have time off. They've not had a day off in weeks, but they come back every single day because that's what the agency needs them to do. Is that correct? That their loyalty to the agency and their loyalty to their cases, to their victims. Okay. I'm going to come back. I don't care if I don't have a day off. The agency needs me. My victims need me. I'm going to come back. Where does that fall into loyalty to family time? Okay. And does it reach the point where we as a chief or a sheriff can recognize that and say, okay, we appreciate your loyalty. You've got to spend some time with your family. We normally don't see that until their family life explodes. Anybody heard of the book Emotional Survival for Law Enforcement by Dr. Kevin Gilmartin? It's kind of the gold standard for cops. I know when I was a chief, every single person in my agency had a copy of that. When they read it, they were told to take it home to their spouse, their kids, or their significant other. It's important that we not only train our cops to know what to look for, but it's also important that we train our family members to know what to look for. This was interesting in that Marshal's office survey as professional standards compared to other first responders. Responding to critical incidents were about even with law enforcement and firefighters. 61% said, yes, that affects me. That's a stressor. But negative media, negative public perception was 400% higher for cops than it was for firefighters. And then threats made to me or my family because of my profession was over 4 times higher for law enforcement than it was in firefighters. So do these stressors, again, contribute to a problem we see in officer wellness? Absolutely. Again, just some of the highlights there as far as what stressors that were identified by law enforcement officers that were significantly more than other occupations. Then we looked at reasons for reluctance to seek assistance. It just doesn't apply to me. Okay, I don't need that stuff. Fears of career impact is huge. How is this going to affect me as far as working here, being able to get promoted, being able to get transferred into a unit, handle it on my own? You know, I can remember in 1984 as a young cop and something happened, what'd your FTO say? You know, suck it up, buttercup, you know, move on. We don't do that. That's psychological thing. I worked for a 2,500 person agency. We had a lot of resources even back in 1984, but were they utilized? Not at all, because it was that stigma or that culture that we had in the agency. Confidentiality concerns. Again, the stigma. We first started talking about that word stigma probably in this room a decade ago about opioid abuse. Those that were facing dependency had that stigma attached to them. Well, now we in law enforcement are fighting that stigma that's attached to cops that are saying, I need some help. I need some assistance. It's just the way I am, or I couldn't find resources, or the reasons that were listed. We've got to change that culture. We've got to change the culture that for our cops to say, it's all right. It's all right if you need assistance or we're here for you, rather than, okay, it's a disciplinary thing. I'm going to take you off the road. I'm going to force you to go to these counseling sessions or whatever. And then as far as you getting promoted, that's off the list. We've got to change that culture. The National Alliance on Mental Illness, NAMI, says that 19% of all active law enforcement officers suffer from some type of PTSD. So that translates to 150,000 police officers across our country that are facing PTSD in some form or fashion. And then we've got the issue of resources available. In our state, 50% of the states in our country don't recognize PTSD as a workers' comp issue. North Carolina, we do. We're still working some issues there because workers' comp wants to say, okay, Officer Miller, you were involved in this incident in this date, working with this agency. Does that fall under our purview? We'll look at it as a case-by-case basis. If Officer Miller came from Maryland for 20 years and worked child abuse cases, child sexual offenses, comes to work for me in Wrightsville Beach, and he's there for 5 years, and he comes to me as a chief and says, I've got some issues. I really need to talk to somebody. We'll say, well, did that issue occur in North Carolina while you were working for the Wrightsville Beach Police Department? And can we pinpoint the date that it happened? So we're working with the League of Municipalities. There's a bill out there that basically just says PTSD is a disease that rises out of employment as a first responder acting within the course of his or her employment. So it doesn't matter if it's that single incident or an accumulation of 25 years of responding to garbage where an officer's just had enough. We want that covered through our workers' comp. What are we doing about it? Senate Bill 300. It was enacted in September 2021 as a police reform bill. It did a lot in the area of decertification indexes and different databases, Giglio, different things that we weren't tracking as a state. We are now. Director Allen mentioned the new training requirements and mandates around officer wellness and resiliency that came out of Senate Bill 300. Mandated early warning systems. That was kind of a game changer for us as police chiefs because the legislature in 2021 says you will, by 12 months from now, have early warning systems in your agencies, and you will start to track some of these mental health issues. And there was 4 things that the state says we have to track. And that's the instances of discharge of firearm, instances of use of force, vehicle collisions, and citizen complaints. So we have to keep track of our cops in those areas. But unfortunately, about that same time, the National Institute of Justice, through the US DOJ, published a report entitled Early Warning Systems Responding to Those Problem Officers. So we, as police chiefs, wanted to focus our intent on these early warning systems as police officer A, this isn't in place as a problem officer and to ruin your career or to use it as discipline. An early warning system is in place to save your career. And again, we're trying to change that culture and change that mindset, that officer's mindset that getting help is not a problem. Again, that article didn't help us a whole lot as far as terming them problem officers, but we immediately partnered with the UNC School of Government. Anybody knows Jeff Welty, I refer to him as the smartest man I know. He's a great partner. We do a lot of things together. We immediately started doing webinars with our chiefs across the state. We had over 400 log into these webinars on establishing, developing, and implementing early warning systems in our departments. Chief Thompson, at the time she was with Winston-Salem, she represented our large departments. Chief Stokes from Salisbury represented our medium-sized agencies, and Chief Hess represented our small agencies, because the resources that Chief Thompson had at Winston-Salem, does Chief Hess have those same resources at Roxborough? Probably not. Chief Thompson was able to buy a separate software program that did all the tracking. I think they had 27 red flag indicators where the state required 4. An agency like Roxborough may use an Excel spreadsheet and depend on supervisors to enter that data. But whatever it was, we wanted to be there for them to help them implement these early warning systems. We then looked at partnering with Lexipol. And you'll see we did it in a webinar format. Why are webinars so successful now where in-person training has not been as successful for us with our chiefs recently? Staffing. You know, I used to ride a shift every week with my cops because I wanted to. Now chiefs in a lot of agencies are riding shifts with their cops because they're required to, just to fill the zone cars. So if we could do this in webinar format, a chief's able to log in, again, this webinar with Lexipol, our next one is scheduled not until August 29th, but Dr. Gordon Graham, he's the policy guru for the country. He's been involved with that. He came and spoke with our chiefs, did a 4-hour block in January on policy formulation involving officer wellness. Kevin Gilmartin, again, emotional survival for law enforcement. Dr. David Black and Dr. Janice Brower are conducting these wellness seminars with our chiefs to help implement effective policies and programs. Agency assessments. We as an association will go into a police department at the request of that chief or the city manager and look at making sure that they are operating under policies utilizing best practices. And when I say best practices, it's best practices at that time. What we used as best practices 5 years ago may not be proven to be best practice today. That's why we appreciate the research to see if what we're doing is effective. But we can go in and make sure everything from evidence collection and maintenance through their wellness programs that they are providing wellness for their chiefs. And a lot of it is free. I put up here some IACP tools, the Resilience Toolkit, the monthly wellness. Even if an agency has zero money budgeted for wellness, we can provide them tools through the International Association of Chiefs of Police. Our ultimate goal as far as agency assessments is having that agency ready for accreditation. Very proud to say, as the chairman of the accreditation committee, it's a new program in North Carolina. Everybody's probably familiar with CALIA. It's a national accreditation, but it's very expensive. So we have created law enforcement accreditation in our state So any agency, it's free. It's free to every single law enforcement agency in North Carolina, and make sure that their policies are working under best practices. We have 116 standards. We even go above and beyond what national standards indicate. I was talking to Mr. Miller about body armor. We require agencies to issue body armor and to have a mandatory wear policy. It's great to have the body armor, but is it doing any good in your trunk? Not at all. So again, we're looking at best practices, and we think accreditation is a way to reach that. We were very fortunate to receive $1.5 million performance and wellness grant from the legislature this past year. Again, working with Michael Grant in DPS, trying to get all of our packages together. I hope that we will have the first $750,000 to give to any police department or sheriff's office that needs a wellness program in their agencies. We've already got a committee set up. We've got the application process. I was at a regional training in Mania where we had 4 elected officials said, we think that's great, but that's not near enough. $750,000 across our state will be gone like that, but it's a start. So we're very proud to be able to offer that grant to any police department or sheriff's office in the state. I mentioned RAI. I'm not going to, Ms. Hoffer and Mr. Beck are going to go into specifics on RAI, a peer support, critical incident debriefing program that they've got that is fantastic. Again, it provides those resources to some of our smaller and mid-sized agencies that may not have that within. So we appreciate the partnership with RAI. And then finally, we look at, as chiefs, we're doing what we can for our cops, and we feel like we're making really good progress. But what are we doing for each other? You know, we can send our cops to counseling. We can get our cops involved in wellness program. Do chiefs and sheriffs do, and I don't have anything to do with the sheriffs, but as chiefs, do we face stressors that are unique to our profession? Try managing crisis within your own organization, but then crisis within your community day in and day out. And there's political pressures. Believe it or not, you know, we say the sheriffs are the politicians, the chiefs aren't. Believe it or not, police chiefs are under a lot of political stress. It's nice to be able to pick up the phone, and we provide that peer support with other chiefs that have been through that. If we've got an officer that's been critically injured or killed, we want that peer support, other chiefs to be able to respond and help that chief in that when he or she is in need. Substance abuse issues, again, crisis navigation, ethical dilemmas. We've created an app. We've got, the association has an app. We will have an icon here in the next couple of weeks that will provide resources for a chief, for either themselves, for an individual officer, or for their agency. We partner with Doable Health, Shatterproof, Essential Personnel, FMRT, Lexapol, among others, hopefully RAI, to be part of that resource for our chiefs. I had an officer who will remain anonymous state that the emotional injuries, relentless hours, stringent work requirements, a constant microanalyzation by society would take a toll on any person, even if it occurred once in their lives. Law enforcement endures these conditions almost daily. We owe it to take care of our family in blue so that they can take care of us when we need them. So hopefully we as police chiefs have recognized that, and we are there to take care of our family in blue. So I appreciate your time.
Thank you, Bill. That was a great introduction. I think the theme of this particular session is talking about health and wellness, and I don't want to understate the experiences, the external stressors that law enforcement experience on a daily basis. But I think one thing that goes frequently understudied is the stressors that are happening inside the organization, from top down or bottom up, inconsistent policies, inconsistent promotional practices, staffing issues, resource issues, and that's what we're going to be talking about today. So I'm going to talk about the Compass Toolkit. It's customized offerings for mitigating and preventing agency-specific stress, which is a mouthful, so thank God we came up with an acronym. It's a self-assessment, self-guided tool that a free one, I should say that first, it's free for agencies to assess their staff across their agency on the top stressors that they're experiencing, come up with strategies for mitigating those stressors, implementing it, documenting the metrics to see if there's progress, and then developing a sustainability plan for long-term. I'm a research analyst here at RTI International, and my colleague Jen Rainier, who wasn't able to be here today, is an organizational psychologist at RTI. Okay. I'm going to quickly go through the project background and purpose, the process for developing the Compass Toolkit, and the lessons learned that we had from our 2 pilot sites. We partnered with Green Bay Police Department in Wisconsin and Redlands Police Department in California, and then long-term implications for research and practice. I'm not going to go into gross detail on the experiences of law enforcement on a regular basis with stressors, but as I mentioned at the intro, what's lesser studied is the internal stressors that law enforcement experience inside their organization. And existing research hasn't done a great job of learning about those stressors and trying to apply different strategies to mitigate those stressors. They often take a one-size-fits-all approach with these programs, assuming that all law enforcement officers are the same, when we know roles can differ massively within an agency, and agency can differ even within the same community. So what Compass tried to do was take a rigorous approach to learning about stressors that are happening internal to an organization and external, and then come up with strategies that command staff can take to apply to their organization with different levels of engagement and burden. So we didn't want to say, okay, you're experiencing stress, you need a training. Everybody needs training. That's why we're all here, right? But sometimes we just don't have the resources to do that or the time. So there are graduated approaches to addressing these different stressors. Compass has 5 steps for, well, there's different processes, but there's 5 overarching goals for assessing the health and wellness of your agency and what officers are experiencing. Listening to the needs, the existing needs of your law enforcement and staff, understanding what are the root causes of those stress, identifying actionable areas for improvement, implementing those areas for improvement, and then assessing and seeing what's happening. Culture change can take a really long time, so we want to have a plan in place for 6 months down the line, 1 year down the line, 2 years down the line. How are things going? We recommend a systematic process for doing this. First step would be identifying your champions. We recommend at least 1 or 2 people. One person leading this charge can be fairly burdensome, but if you split it between 2 people, hopefully they can share the load, and ideally you would choose people who have, the respect and the clout within the organization for people to listen to them. Conduct your baseline assessment, which is a survey to see what sort of stressors law enforcement are experiencing. Select your strategy. Again, the toolkit will guide you through which strategy you can use. Implement it, do your follow-up assessment, ideally 6 months to a year later, and then develop sustainability planning for long-term. The baseline assessment covers the gambit of external and internal stressors. What are the top stressors for sworn and professional staff? Organizational stressors like staff shortages and lack of resources. Operational, like shift work or your family and friends not understanding your sorry, this is like so far away from me. I'm too small for this podium, y'all. Okay, what are staff already doing to manage their health and wellness? The impact of the implemented strategy and your demographics. You want to apply the context to know who that you're surveying. All of the items within the baseline assessment align to 10 focus areas. They're all listed up on the screen, and the toolkit will guide you through a process of looking at your results from your survey and identifying the top stressors. It's unlikely that everyone in your organization is going to align on one stressor or one focus area, right? But we don't recommend tackling more than one focus area at a time. I think you'd get into you've bitten off more than you can chew situation. So if you have the results that you've accumulated and there are multiple focus areas that you've highlighted, you can ask yourself a couple of questions about what, to help you narrow it down, like what are some existing strategies that officers are already applying? What do you think would resonate the most with staff in terms of a focus area? I think the value of staff feeling heard and listened to and realize that there are actions that are being taken and, that command staff is making an effort to try to revise the internal organizational issues cannot be understated. And then maybe officers are already implementing their own strategies, so you don't need to do anything. Once you've selected your area of focus, you can gather some additional information. You could do interviews, but one of the easiest ways to do it would be to look at the open-ended text responses in the baseline assessment. So there are a number of questions where law enforcement officers and staff were able to kind of put in their story that gives a little bit more context than just answering a question as it's labeled. For any strategy, we recommend setting goals. I think it's common to go to a training, hopefully not one like today, because you're going to take lots of things home back to your agency, but time passes, right? Maybe a week, and your commanding officer says, "What do you learn?" And you're like, "I don't know, I was there." Writing things down, talking together as a group, setting an individual action plan, setting a group action plan, and then setting metrics for success. I think culture change can take a really long time. So setting goals that are achievable within your organization and getting input from across your organization of what success looks like is really important. Convening your project teams regularly to get input and ensuring that you're communicating progress across your organization. I wanted to show a couple of pictures from the toolkit. So this is an example of a strategy page. So if you wanted, say you did your self-assessment and you found that your staff were saying they really felt like there was a favoritism issue in the promotional process and leadership issues. Well, you can narrow in on that inside the toolkit and see a variety of resources that you can choose from with varying levels of burden, from a 15-minute podcast up to a 3-hour training. So you can decide what your agency has time for. And, if you have an agency champion, what they would recommend that you do. And then each of those listings within the resources are live links that would then take you to a detailed page with additional information. The other thing that's great about this is that it shows kind of upwards the different focus areas that it aligns to, which is nice because, as I mentioned, you want to hone in on one particular focus area, but that doesn't mean you can't get the most bang for your buck. So if you're going to choose different resources, it's helpful if they can align on multiple focus areas. And then this is an example of a detailed page. So if you had clicked one of those links, it would show you, okay, this is best for addressing leadership, pressures, conflict, resources issues, and then it has information about what the tool is and then how much burden it would be for your officers to complete. I wanted to show a couple of screenshots from our pilot sites. This was the Green Bay Police Department doing their action plans and the Redlands Police Department doing their action plans. They met as a group, and we did follow-up assessments with them 6 months later, and they overwhelmingly agreed that one of the biggest findings that they had wasn't actually the culture change or any of the changes that they had tried to implement, but just the process itself, that they finally felt heard and listened to, and the value of sitting down as a group together and talking about it out loud instead of in back corners about how they were frustrated that Joe got promoted and they should have gotten promoted, and they were doing it all out in the open. Some other lessons learned from our pilot sites, we found, as I mentioned earlier, multiple champions are necessary. This can be burdensome for folks to do if you're leading this charge across your organization, so splitting the burden is really helpful. Be thoughtful about the role of executive leadership. You want to find this healthy balance where command staff have provided legitimacy and credibility to any changes that are happening, because chances are you're going to get pushback anytime there are changes, or anytime you're trying to make changes within an organization. People are like, why are we doing this? And it's really helpful to say, hey, well, this is driven by you. We did this self-assessment and these were the top stressors that we found. And now we're trying to make changes so that this is a driven, a group effort. But you also want to make sure that you have times when executive leadership aren't necessarily in the room. No offense, chiefs, but sometimes that can hinder free and open and honest discussion because they're afraid of the blowback that would happen if command staff were in the room. So portions of these action planning meetings should probably have no command staff in the room. Ensuring effective communication. What we sometimes see with agencies is a top-down approach where it starts with the chief, they tell their command, it goes down from there, but it's a game of telephone that gets broken at some point. So if you take the approach of spreading this information across the entire agency so everyone is receiving the same information and it's transparent, that's going to really improve. And finally, just free and open discussion. I think there was another interesting point that we found. We did this particular study during 2020 to 2021, so peak COVID and defund the police and anti-police sentiments, and it was a really volatile time in our world, and yet our 2 pilot sites still chose inconsistent leadership and perceived favoritism as their top stressors. Long-term implications for research and practice, we just want to make sure that we keep learning from this. We would love to receive anecdotal results from agencies who try to take this process on their own and learn things that are working well and things that aren't, so that we can continue to improve the toolkit. We always recommend starting with an assessment. Don't assume you know what law enforcement are experiencing. I mean, sometimes people talk about it and a lot of times people don't. So starting with an assessment where people can feel able to give their experiences in a confidential environment, like a survey. And last, I'll just mention, as this seems to be a running theme throughout this symposium, is partnerships, the importance of partnering with research organizations. And we realized that, with doing something like this, having a consultant or a research partner is vitally important, but isn't always feasible because maybe that costs money or resources or time. If you need to, you can also consider local university partnerships who often have graduate students or research centers who can do this and are ready and waiting and want to do it for free. The last is I'll just show a screenshot. This is our toolkit. As I mentioned before, it's completely free. It's an interactive PDF that you can download and access on your own. We also have handouts on the table out here. And if you want to learn more, you can always shoot us an email. Thanks so much.
So nice to be here and have the opportunity to speak about this project. My name is Merit Hoffer, and I'm a research psychologist here at RTI in the Workforce Wellbeing and Effectiveness Program. And I'm joined by Erin Back, who is the peer consultant for the Responder Assistance Initiative. So we're going to tag team this presentation a little bit. So the main goal of this evaluation was the issue of how to get law enforcement to actually access the programs and services that are becoming increasingly available to them. So I'll start with an overview of what RAI is. Next, I'll talk about the evaluation goals and methods very briefly, and then I'll specifically highlight the recommendations that have come out of this project. And I'll hand it over to Erin, who's going to talk about how the culture shift and approach to wellness has changed in the State Highway Patrol here in North Carolina. All right, so let me tell you a little bit about RAI. RAI started as a grant-funded effort under a different name in 2019 with the goal of providing specialized, accessible, and confidential mental health care or mental health and well-being services to North Carolina Department of Public Safety employees. And fast forward to today, RAI has been moved under the Division of Emergency Management and is now charged with providing those same services to all first responders across the state. Historically, the most common way that police mental health has been supported is through the provision of standalone services, peer support, EAP, chaplaincy. And what makes RAI unique is that it takes all of those services under one umbrella and integrates them into one safety net and unifies those responder support systems. So the mission of RAI then is to lead a holistic initiative that addresses stigma in the agencies and brings evidence-based support to the agencies and the public safety workforce. And that's done through prevention and early intervention efforts, the integration with peer support, and access to trauma-informed behavioral health services, in some cases even with embedded clinicians inside the agencies. Now, since RAI is in the beginnings of a very significant expansion, they partnered with us at RTI to gather some data-driven next steps on how to increase the use of these services in the public safety workforce. And so we focused the evaluation on one main goal, one issue, which was to identify the program level changes that would help to maximize the accessibility maximize the reach of RAI. So we partnered with 5 state law enforcement agencies in this project, including the State Highway Patrol, Alcohol Law Enforcement, Capitol Police, State Bureau of Investigations, and the Department of Juvenile Justice. I'm not going to go into a ton of detail on the evaluation methods, but I'll provide a little overview, which goes hand in hand with some of the things we've already talked about in terms of how to guide these processes through practitioner input. So when we started the project, we wanted to involve all relevant stakeholders in it from the beginning. And this means we took an approach where we first used qualitative methods, including focus groups and interviews, to gather the perspectives of different DPS staff in different roles. And we would then use that information to build a survey that could generalize out into the entirety of the workforce of those partner agencies. So as I mentioned, the qualitative phase then included focus groups with RAI stakeholders that included law enforcement leaderships, mental health providers, peer support officers, RAI leadership. And the interviews were held with officers who had and had not used RAI services. And the goal of these discussions was to capture some complementary perspectives from different stakeholders about how the program was working, what wasn't, what could be improved. And then everything we learned, we translated into a survey that was administered statewide to the partner agencies. And I'll tell you a little bit more here about the content. So we contextualized the survey, of course, with some basic demographic and professional details. We gathered information, perceptions of stress, mental health stigma, job satisfaction, turnover intentions. And then the meat and potatoes of the survey really was about the perceptions of RAI services. How much did people know about it? How did they prefer to hear about it? What services would they use? Have they used? Would they consider using? And so forth. So the survey was administered to all of that, the staff, the sworn and non-sworn staff in the agencies that we partnered with, and that was over 4,000 people. We ended up with a response rate of just over 40%, which we were excited about. I mean, we really got a lot of input, which is just another sign that people really care about this topic. So what did we learn? We identified a range of recommendations for improving the accessibility of these services, and these recommendations are helpful both for wellness providers as well as law enforcement leadership. So I'll walk you through some of those. The first set of recommendations relate to improving agency climate to support the use of services. So specifically, there was a need to increase the perceived value of mental health services in these agencies, because when respondents saw them as valuable, they were, of course, also more likely to intend to use them and actually use them. There was also a need for addressing mental health stigma. Oops, what happened here? Sorry. There was also a need for addressing mental health stigma, and we talked about this a little bit. Now, what's interesting is we assessed mental health stigma in 3 different ways. We considered self-stigma, so the idea that seeking services implied some kind of personal weakness or inability to perform police work effectively. We also looked at social stigma, so the idea that seeking services could cause you to lose trust or standing with your colleagues or supervisors. And then we also looked at structural stigma, which is the idea that seeking services could have negative career impacts. Now, overall structural stigma was the most prominent type of stigma that was endorsed. Interestingly, I mean, you all probably are not surprised about this at all, but in the US policing context, this is not the place we have focused. We have focused on interventions for self and social stigma. So this is an area where there's still a lot of work that can be done. The second set of recommendations concerned addressing issues around confidentiality. So we know that it's helpful for service providers and law enforcement leadership to work together to normalize service use, make the services visible, but we also know that there's this context of stigma. So the programs have to be very, very intentional of how they position themselves and the relationship that they have with the agencies. So we recommend that, I'll give you an example. RAI has lots of safeguards in place to protect officer confidentiality. But among our respondents, typically, they either didn't know about those safeguards or they didn't trust them. So there's an opportunity here to put all of that into some comprehensive set of documentation that can be given to prospective clients, to officers in the outreach and communications that they receive. That way they know what to expect if they should seek services with this program. In a similar vein, and this is going back to that structural stigma piece, we also recommend that police agencies document their comprehensive mental health policies. And so this could then provide more clarity to officers about what the actual consequences of engaging services might be. So things like, for example, overtime eligibility can be addressed in these documents. When someone would be placed on modified duty, what would be the process to coming back to regular duty? And really putting that all on paper so that everyone knows what the situation is, because if they don't, they're going to default to the worst case scenario. The third set of recommendations relates to effective outreach. So even though RAI has a ton of different services, for the most part, respondents only knew about very specific pieces of those services. So there's an opportunity to just generate more comprehensive outreach materials that really highlight the full breadth of services, as well as some of those specific issues that we know folks are concerned about, like, for example, confidentiality. The second piece here was to leverage different stakeholders in the outreach activities for these programs. So, the program's going to do outreach, the providers, the leadership of the programs, but what's important is also to engage agency stakeholders. So respondents primarily heard from their leadership about RAI. But that also meant that the information they had was usually limited. So there's an opportunity to generate documentation that can be passed along to law enforcement leadership and handed out and passed out to staff in these regular communications that leadership have with them. Finally, the last set of recommendations was about how to optimize service access and utilization. The respondents agreed that RAI services are extremely helpful and useful to them, but they also had some very specific preferences for how to, for the types of services that they were most likely to engage in. So in a place with limited resources, we recommend, of course, optimizing service access by increasing capacity for those specific types of services. At RAI, that was clinical services and peer support services. A unique aspect of RAI is the integration of peers within the administration of the program. And this is something that we feel could be beneficial in many different contexts. So when individuals heard about the program through peers, they also knew about other aspects of the program outside of the peer support piece of it. So this integration supports greater knowledge about the available services, makes them more accessible. So this is likely a model that any agency can pursue. If you have peer support officers, get them in the same room with your providers, get them pulling in the same direction and working together. And then finally, this is a little bit more unique to RAI. They saw a great positive impact from embedding providers into agency settings. So folks in those agencies knew more about RAI. They also felt that there was more support for mental health among their leadership and in their organization. So really great cultural benefits. And while not every agency can do this, RAI does provide a model for even bringing in clinicians on a part-time or as needed basis when the need arises. So there's some great lessons to be learned here. So I know these recommendations are a lot and might sound a little bit abstract. So I'm going to hand it over to Aaron here, and he's going to tell us a little bit about how the State Highway Patrol has done some of this work in shifting the approach and perspective on mental health.
You will quickly find which of the two of us is the more intelligent. So my name is Aaron Back. There's been a couple things up here. So I'm retired from the North Carolina Highway Patrol. I'm a reserve officer with ALE. I run the North Carolina Law Enforcement Assistance Program, and I work part-time as a consultant, as a peer with RAI. And so what we wanted to discuss, and the reason why Merritt asked me to come up here, is to give you sort of a case study of, man, how did we get here? How did we get to this part? There's some things that I would like to mention. I know that Trevor said it this morning, I know Bill said it too. There's a problem. There are more law enforcement officers who die each year by suicide than by fatal assault or by accident. So there's an issue. And there's a way that we have to address it. But here's another problem. And here's some of the things that Merritt and them were up against when they were coming to look at, man, how well is this working? How do we make it better? Is that no one is going to help us the way that we can help us. And it's primarily because we don't trust you to. And now that is a true statement. And if we're not going to trust others to help us, then it falls back on us to figure out how to do it. Now, there's more than a casual relationship between the therapists, clinicians, whatever you want to call them, and the peers and officers on the street. And so the two have to get to where they are comfortable with each other so that they can be effective. So if you're looking at how do I implement a program like this, how do I look at taking care of our officers, how can we be better at this thing? It takes time. So this timeline here shows you how the patrol started with it and how they started looking at it. And to their credit, a bunch of just grumpy old men, we call knuckle draggers, right? Who had no better idea, but they just said, hey, you know what? There's a problem. And they took it upon themselves to say, we have to do better. And the reason why they said we have to do better is because their own friends, their own peers were becoming alcoholics. We're leaving the profession. We're getting in trouble for domestic violence. We're having issues of their own that made them say, hey, we need to address this. And they were so intelligent to do that because had we just brought in a therapist and said, hey, something's wrong with y'all, we already knew that. And we're not going to trust somebody from the outside to help us. So it layers the problem. So in the 80s, they started looking at this thing and they said, hey, this is what we're going to do. We're going to create a peer team to start looking at how do we take care of each other. And then they started addressing these needs of, man, how can we go a little bit further? And so they created these things called this post-critical incident seminar. And that was along the time they did it was the Secret Service and the FBI that created this model of this thing called the Post-Critical Incident Seminar, which is a 3-day seminar where we bring officers and their spouses, significant others, whatever it may be. We bring them in, they get an opportunity to sit with other officers who have been involved in critical incidents, and they get a chance to grow. And they get a chance to learn from each other. Now, I can tell you when I came on in 93 and they came around and told us, hey, if you ever need anything, let us know. We're here to help you. And I thought, I'll never need that. And I'm not ever going to need that because even though those resources were there, just like they are now, I didn't trust them. I looked at my colleagues, they look fine. That means I need to be okay. You know, you don't look like you're struggling, so I shouldn't be struggling. But the reality of it is we were all struggling, but nobody was willing to communicate about it. And so through these processes and starting to learn this stuff, and matter of fact, all the way through the early 2000s, I didn't believe in any of this stuff. I didn't believe in peer support. I didn't need it. We help others. I don't need help. Until it came to my doorstep. I had already had people try to kill me. I had already been involved in a lot of things. It didn't matter. That's part of the job. We suck it up. We move on. That's part of it. My niece was killed walking across the street in Williamsburg, Virginia. My brother responded to his own daughter's death. So now I've got a problem. I have to figure out how to help my brother get through this stuff because I don't know. And so I carried him to this post-critical incident seminar. They made us go. And I learned there that what these peers can do. We sat in a room with a U-shaped table with 40 people sitting at the table and another 40 people sitting behind us. And if you've ever been in law enforcement before, that's an uncomfortable situation. And then they handed a mic to the first person and said, tell us why you're here. That's an even worse situation. And then when they start telling their stories and they come around, my brother literally looked at me and said, I'm going to kill you. And I was like, man, he said, I'm not going to talk. I said, I'm not either. But as we heard these stories go around, when we heard our own brothers and sisters sharing what they had went through, he looked at me and said, I'm going to tell the story of Bella. And so he tells the story of Bella's death. And after he gets done, one of those weird people that are sitting around behind us that we keep glancing at going, hey, what are they here for? This guy walks up and says, hey, this is who I am. And my daughter was killed also. So my brother, who went from hiding from us, staying drunk, was not going to re-engage into the job. Within 30 minutes, he's laughing with this guy. He's able to talk to this guy because he met somebody who said, man, I've been there before. Let me tell you how I had to get out. Now, I tell you that scenario because it's that critical when an officer is dealing with something. It takes somebody else to look them in the eye and say, man, I've been there before. And then after they finally open up, when you finally get them to the point where they're saying, hey, I may need something, it's then I can say, okay, well, look, I can work with you. And we go through some stuff, but let me tell you about Merritt. Using Merritt as an example, she was a therapist. I can't just say, hey, call this number, call this EAP number. Not that EAPs are bad, but I'm just saying there has to be a personal relationship with it to open it up to say, hey, look, I trust her with my life. You can talk to her. And that's normally when they're going to get help. Because if I don't know the resources that I'm handing them to, for those of you in here who have been in law enforcement before, it's normally a one-shot deal, is it not? Everything that you've thought about mental health, everything that you've thought about needing help and reaching out for help. If I give you a resource, you go to that resource and it doesn't work, what have I done? I have helped you live up to everything that you have thought about it, and you will never reach out again. So it's critical that we build out these processes so people understand what it is. So it's information, education, and resources, but you got to know. So the second part that I'll ask, and I ask this to a lot of commands and I ask this to a lot of chiefs, is how serious are you about taking care of your people? Because it ain't fun and it ain't pretty. How serious are you about taking care of your people? Because some of this stuff is ugly. It's ugly when you have to have an officer who goes offline because they're in a 30-day treatment program. How serious are you about helping your people? How willing are you going to be? Let's get them the help they need so that we can work them back into the job. Not everybody in this room can raise their hand and say, yeah, I can do that. So this linear thing that you see, it's a process. You talked about culture. How do you change a culture? You change a culture one person at a time. And so it's going to take leadership, and it's going to take the brand new officer to look at this thing and say, how serious are we about taking care of our people? Because yes, there's problems in the community. There's other things that are going on. There's tons of stuff that's going on. When you look at retention and you look at hiring, you've got to be able to answer that question. Because how much does it cost if you lose an officer from the job after you have trained them and they've been on the road for 5 years? That's a lot of money. How much does it cost if one of your officers dies from suicide? That's more than money, right? So how serious are we going to be? And you see, as this thing moved along, the Highway Patrol build a peer team. So yeah, man, we're pretty good at it, but we've been doing it for 30 years. And we also got a monument with over 70 people that are on there. So we've had to learn these things. Not every agency is at that point. So we have to be able to work together, collaborate, learn from each other, and see what is it that we can do to address these issues. So we went from having the peer team to not only finding this training, and we use the International Critical Incident Stress Foundation. It's a gold standard, but there's tons of different trainings out there. And so as we started moving along this thing, we found out there was a need, there was more need than just having a peer team. Those post-critical incident seminars, they weren't being held in North Carolina. And we couldn't hold them in North Carolina, not just as the patrol, because you got to raise money or you got to charge money. And as a state agency, we couldn't do that. So that is why the North Carolina Law Enforcement Assistance Program was built. That's the reason why it was created, so that we could have resources outside of the food chain of the Highway Patrol, but another resource, because believe it, we've got the Members Assistance Team. We've We, unlike a lot of agencies, have our own medical offices staffed with doctors. We have a chaplaincy program. We have all of these resources in place. And guess what? Not everybody's going to talk to a MAT team member. Not everybody's willing to talk to the doctor. And not everybody's willing to talk to the chaplain. So what if you just have one officer who's not willing to use any of those resources? You've got to have something outside that you can trust. We use this terminology that's culturally competent, right? So there are tons of therapists out there. Not all of them are culturally competent or understand the job from the aspect of the way that we need them to understand it. Because some of these officers are being involved in stuff and they're walking into this room and they're saying, hey, look, I was involved in the shooting. I got no problem with the shooting. This is what the issue I'm having. And so if you're not understanding of the way that we're trained and the way that we are brought to do these things, then you may look at us and go, well, they're homicidal. When the reality of it is that we train this into them. They are trained to go home. It doesn't mean something's wrong with them, but the problem that they're having with it is now their kids can't go to church anymore because people look at them weird. Kids are picking on them at school. So there's other issues. So there's these things that we built out, these things that we started looking at. So NC LEAP was good. So now it was addressing the needs of the things that were outside of our organization when we needed them. But there was one problem. The problem is that when we do find that person, so 95% of the time, peer-to-peer contact is going to be good. But about 5% of the time, you're going to need somebody outside of that. We train peers to, they understand is the number one thing is knowing when you're over your head, right? And so when you're over your head and you need that therapist, what resource do you look for? So the resources that I was having to look for, they were from South Carolina, they were from Virginia, they were from outside of the state because they weren't available here. And so when we had the opportunity to create the integrated behavioral health system that was just for state law enforcement officers, and when we had an opportunity to build that out, we hired culturally competent clinicians. I hired every one of them. And so we had an opportunity to see, what do you believe in? How are you trained? How do you process trauma? Who have you worked with before? And so most of these folks were either in the first responder community before or only had worked with first responders, and their training is nonstop. And so as you see, it moved on. And then as the separation and the growth with the Department of Corrections and the things that were moving out of DPS, it became necessary for us to look at it and go, hey, how do we continue to do this? How do we continue to do this? And so the reason why it moved to emergency management, and again, because of DPS allowing, and as you said, the chief, the deputies, the secretary is a retired chief, it became necessary for them to understand, hey, look, this was a petri dish. We were trying to figure out, will this work for state law enforcement officers? Because it needs to be available for all first responders in the state of North Carolina. And the reason why it moved to emergency management is because now it's still in DPS. But the reason now it's over there is because every county in the state has an emergency management, and they exist because if the needs are greater than what you have locally, you can make a request to the state to get those resources. And so it's based in emergency management now. So if it is Roxborough or whoever that needs it, all you got to do is make the request and you have the same resources that all the other large departments have. You have the same resources that we use to respond to critical incidents, whether large or small. You have the same peer teams. You have the same stuff. It's not to replace peer teams. It's not to replace what you have. It's to accentuate and help, right? And so as you move forward, these next chapters is the growth of the RAI is getting people to understand, because of the January 1st, it is now available to all first responders in the state of North Carolina. And so we have to, one, get to where you can embrace it, you can understand it, and you can trust it. And once you embrace it, you understand it, and you trust it, and then we can take it and we can spread it amongst ourselves. Because even still today, it doesn't matter how big, how great we get at these things, I'm probably not going to trust it until she goes, yeah, you can trust it. And we have to be able to embrace that. And I do speak at a lot of Chiefs conferences, and I love Chiefs, but is this not a reality? Because you were a cop as well. If he were to walk up here and go, hey, look, I bought something for you. This is the greatest thing in the world. It answers all your questions. It's going to meet every need that you told us that you had. I'm going to leave it right here at yours. As soon as he walked out of that room, what would we do? Don't touch it. It's a trap. Right? And so we have to embrace this idea of growing it from not only the top, but down to the bottom. because there is a price to pay, and not all of it is going to be monetarily. So lastly, I'll ask you is how serious are we about taking care of our people? Because it became obvious to us, and it became very a hurtful learning process for us on the patrol. But I will tell you this lastly about how serious we have to be is Colonel Bill Gray, who's been gone for a while. We had an officer who maybe or maybe not died by suicide. And we couldn't figure out the equation. So he walks in my office and he said, hey, here's the thing. Are you 100% sure that all of our officers know every resource that's available to them on the road? A lot like the study that we asked Merit and RTI to do for us. And I said, sir, I'm not 100% on anything. He said, well, I want all the resources listed out and I want it sent out. And every trooper on the road is going to sign off on it today. I don't care if they're on vacation. I don't care if they're on a cruise. Everybody's going to be notified about what we have. Do you understand? I said, yes, sir. So we put it out. And by 6 o'clock, everybody was notified and signed off on that they knew the resources that were available. And he walks in my office. He said, what do you think? I said, man, I think it's great. I said, but I think you need to stand by. He goes, what do you mean? I said, you'll see. So within the first 60 days, we had 3 troopers who were in inpatient facilities because he made it okay for them to raise their hand and say, I need. And he said, I don't care. I don't even want to know their name. You get them the help they need and get them back to work if this is what they still want to do. And he not only did he mean it, that process is still in place today. So the reality of it is this, is you have to look at it and you have to understand. I did. I retired from one of the most elite law enforcement agencies in the country, primarily because I say it, but still believe it, right? But here's the thing, within that organization, and it's such a prideful thing to be a part of, to walk across that stage and earn that badge in front of my family and friends. We have alcoholics, drug addicts, people cheating on their wives, and people who don't want to be the police anymore. Difference is we know, we acknowledge it, and we try to help them through that. And I don't care where you work or what agency you're with, you have them too. So how serious are we about taking care of our people? I do appreciate the opportunity to be a part of this, Merit. I appreciate the being in front of y'all. And so I'm sorry if I went over my time or I rambled, but I will encourage and implore you, please, just not only as still an officer, but working with your officers daily. I'm literally going to do a debriefing for a suicide tomorrow. I beg of you, how serious are we going to be about taking care of our people? These problems aren't going to go away when I go sit down. So thank you for your time and attention.
Okay. Good morning, everyone. My name is Lance Miller, and I am a law enforcement subject matter expert on criminal justice technologies, testing, and evaluation here at RTI International. I've been with RTI about 5 years, but I've had the privilege for close to the last 3 decades to be part of supporting the National Institute of Justice's compliance testing program for body armor. My colleagues up here today have told you about some of the really important work that's being done and the increasing awareness that is being given to this whole area of officer health and safety and mental wellness. But what I'm going to talk to you today about is another aspect of that regarding protective equipment technology and the role that we play here at RTI in supporting the National Institute of Justice in ensuring that officers have access to body armor that helps protect them out on the street. So what are we going to talk about today? We're going to talk about NIJ's role in standards and conformity assessment. Our role here at RTI as part of the Criminal Justice Technology Testing and Evaluation Center, and can you say that fast 3 times? The role that we play here in compliance testing and standards, and then to talk about the new body armor standards that are being introduced and rolled out as we speak, and the significant changes and what that means to practitioners out on the street. So starting off with the National Institute of Justice and their role in standards development and conformity assessment. NIJ is the research and development arm of the U.S. Department of Justice. And it is their role as part of their mission to foster and disseminate knowledge and tools derived from effective and rigorous scientific research to inform the safety of law enforcement officers nationwide and develop national standards for various types of protective equipment technologies, First and foremost among those is ballistic resistant body armor. So if you wind the clock back over 50 years ago into the late 1960s and early 1970s, NIJ was very heavily involved in the foundational research during another period in our country's history when there was a lot of civil unrest and public disturbances, and we were seeing a huge spike in officer deaths resulting from firearms assaults. And at that point in time, the concept of ballistic resistant body armor didn't even exist. The closest thing we had was the military's flak jackets, which were intended to really protect against fragmentation munitions. So NIJ, as a fledgling agency in the Justice Department, was tasked with this concept of developing a lightweight concealable protective garment that could protect officers against handgun assaults. And they did that foundational research, and by the mid-1970s, fielded that technology, and we had our first save. But just wanted to let you know a little bit about what NIJ's focus in developing these standards are. First and foremost, it's a focus on the law enforcement practitioner. Everything NIJ does in this area is done because of the input that they receive from the folks in the field. It's not somebody in the industry telling them what to do. It's the feedback from the cops on the streets. What are the threats you're facing? What are your operational needs and requirements? What do you need this body armor to do? Continuously raising the bar for performance. So again, with each iteration of the standard that comes out, we're constantly looking at the evolving threats, the evolving landscape, the advances in technology. Obviously, 50 years downstream, there are materials and that are available today to use in protective equipment that weren't even dreamed of. So again, and how do you test and evaluate that? There's advances in testing methodologies and things that we have learned, frankly, from all of the years of experience in evaluating this technology. Additionally, publishing the documentary standards and guides. So again, the information that you're going to need as the practitioner out on the street to understand what this technology is, what it can do for you, and what you need to know about it when you're purchasing it. And then more importantly, once you've got it in your hands, how to properly take care and maintain that equipment. Again, consensus and stakeholder engagement. So NIJ not only relies on input from law enforcement practitioners, but subject matter experts across the entire spectrum. Testing laboratories, standards development organizations, and the technical experts in the body armor industry. Again, we'll talk about this here in a moment, but coordination with these private sector standards development organizations and how we are leveraging their abilities and capabilities to make our standards better. And then finally, the testing and certification of products. And that's what we do through the program here at RTI, the Criminal Justice Technology Testing and Evaluation Center. So I'll talk about that briefly for a moment. Again, it's the NIJ funded project operated by RTI that provides research, testing and evaluation, operational and administrative support to guide the responsible adoption of technology and practices across the criminal justice community. There are 5 main tasks, and for the purposes of today, I'm not going to talk about all 5 tasks. I'm going to focus on tasks 4 and 5, which is the operation of the compliance testing program and the development of standards. But in the first 3 tasks, we do a lot of evaluation outside of the protective equipment arena on all aspects of technology that impacts the criminal justice system. And that includes some really good research that we're doing right now. My colleague Neil Parsons out there in the audience is doing a lot of good work right now on unmanned aerial surveillance, drone technology, and counter drone technology, particularly as it applies to bringing contraband into correctional facilities. It's a huge problem. And so we're doing the foundational work on that. And those are the things that you will find on the CJ Tech website. Okay. There we go. So again, as the administrator of the compliance testing program, what we do is we coordinate what we call both initial type testing and follow-up inspection and testing. And there's an important distinction between those two. So initial type testing is when a manufacturer brings a new model to the marketplace. And once that evaluated and once it put on our compliant product list so that it's eligible for law enforcement agencies to purchase that. That's the first step in the process. However, By participating in that initial type testing process, they also agree to what we call follow-up inspection and testing, or ongoing product surveillance. And what that means is that periodically throughout the life cycle, as long as that armor is listed on our compliant products list, no matter where your manufacturing location is throughout the world, we are going to send inspectors out to that manufacturing location on an unannounced basis and pick up samples off your production line. And we're going to inspect them and we're going to ballistically test them for two reasons. Number one, to make sure it's performing similarly. But then secondly, we're going to cut that armor open and examine it and make sure that it's built the same way as what was originally tested. So, again, this helps ensure quality management in the process and that the folks out in the field are getting the same product that we originally evaluated and tested. We have a limited staff and we use technology as a force multiplier. We have something that we call the Testing Information Management System, which is the online system that we use to manage this entire compliance testing process, where manufacturers can apply and submit their application to submit models for testing, as well as manage this entire life cycle process through FIT. Additionally, the major output, as I mentioned, is the NIJ compliant products list, which is the listing of all NIJ approved equipment that comes through the program and now bears the NIJ certification mark. And then the other thing that we do, which is task 5, is our subject matter experts provide expertise, engineering, and technical support to the NIJ standards development process. So I'll give you a real quick graphic here that'll show you the overall structure of things. You have the NIJ compliance testing program. The main output of that is the compliant products list of approved armor. Next to that, you see the NIJ certification mark. Since 2016, that certification mark is on the label of every NIJ compliant model of armor that's produced and out in the field. This is your way of knowing. It's kind of like the Good Housekeeping seal of approval or the UL Underwriter Laboratory mark. That tells you that that model of armor has been tested and evaluated through NIJ's compliance testing program. That compliant products list is used in a variety of different ways. We coordinate very closely with the Bureau of Justice Assistance's Bulletproof Vest Partnership Program. That's the grant funding arm through BJA that provides funding to state and local agencies to procure body armor. One of the requirements of that grant program is to be eligible for funding. You have to purchase armor that has been tested and approved and on the compliant products list. Another organization that we work very closely with is NASPO. I don't know exactly what that stands for these days, but they used to be called the Western States Purchasing Consortium. It's a multi-state government purchasing organization that utilizes the compliant products list in their procurement contracts. And then individual law enforcement officers and agencies procuring armor also can access this because it's published online on our consumer products list. And how do we know that this technology is effective? This is one of the really big success stories that we have coming out of NIJ. There actually is no one who officially tracks law enforcement saves, which is kind of an interesting story and a whole nother separate conversation. For many years, the International Association of Chiefs of Police, in concert with DuPont, had a survivors club. And we know from the information that they were collecting that in the last 50 years or so, we've saved over 3,000 law enforcement officers' lives through the use of protective body armor. I can tell you that we also have been tracking here internally media reports for about the last decade. And since about 2015, we have 200 documented cases, and those are available on our website as well. And you can link back to the original articles and learn about those officers' survival stories. Again, over 20,000 visitors came to our compliant products list last year on the website. In the last 15 years, under the current edition of the compliance testing program, we have evaluated over 1,500 models of armor. Now, this is the interesting part. Of those 1,500 models, 38% failed. So why is that important? Because what this program does is this helps prevent designs that don't meet those requirements from getting out into the marketplace. So we're catching those. But then on the flip side of that, the good part is that of the models that are on the list that are in the surveillance testing program, the FIT testing program, 94.5% have passed. And what happens to that other 5%? Well, when that happens, manufacturers have to go back and do a root cause analysis to figure out what happened with that armor, and it may lead to product recalls and, again, getting unsafe armor out of the field. So again, this is very important to ensure the safety of officers across the country. Talking about standards development, we again have a process, and I'll talk about that in a second, about how we develop these standards. And we have 2 new standards that were just published at the end of last year. I'll talk about those in a minute as well. And then we have a couple other standards that are in process right now and will be published probably either later this year or in early 2025 for stab-resistant body armor and for auto-loading pistols. The intent is also in future years to also have additional ballistic protective equipment such as helmets and riot shields involved in the compliance testing program as well. What you see here is our website. It's at www.cjtech.org. And you can scan that QR code, or if it's in the presentations that you get you can also come to the website. And again, you can see the entire spectrum of work that we do as CJ Tech, not only just the compliance testing program. Talking about the new standards. So in November, NIJ published the first revision to the ballistic resistant body armor standard in 15 years. This new NIJ standard, 0101.07, specifies the minimum performance requirements for and test methods for ballistic resistance of body armor. And it is a revision of the predecessor version, NIJ standard 0101.06, which was published in 2008. The second standard is actually a break-apart piece from the prior standard, and this is NIJ standard 0123, which is the specification for protection levels and associated test threats. This is basically the matrix that defines the test levels and the protection levels of body armor and other ballistic equipment. For many years, that's been embedded in the NIJ standard. But as I mentioned, NIJ is working on developing a suite of ballistic protection standards for various types of equipment. And the decision was made to break that threat matrix out as its own standard, which then can be incorporated by reference into any future standard or future revision of the standard. So those are the differences in the 2 standards. The one is the actual test methods that we use strictly for ballistic body armor. The other one is for the threat level specifications. Talking about standards development, how do we do that? We talked about how NIJ leads with the practitioner. They do that through what they call special technical committees, or STCs. And in this particular case, they convened a special technical committee of subject experts on body armor and ballistic protection. And you can see the representation there on the screen of some of the agencies that were involved. In addition to those agencies, there was a participation from a lot of other subject matter experts and some of NIJ's federal partners, such as the National Institute of Standards and Technology, Department of Defense, because obviously there's a lot of crossover in ballistic protection between some domestic law enforcement requirements and military requirements, as well as our NIJ approved laboratories who actually perform this testing. And again, they were reviewing the current operational requirements. A lot's changed in 15 years. So what was, that was one of the things that we had to look at. So what were the significant changes that occurred in this standard? Very quickly, and we'll come back to these and kind of go through them in a little bit more detail, not a tremendous amount at this point, but first of all was the expanded incorporation of ASTM standards and test methods. There were significant changes to the test threat nomenclature and threat level classifications. Again, I'm going to drill into that a little bit more here in a moment, but we changed the entire classification matrix to make it a little bit easier to follow and understand, as well as to be able to adopt some of the emerging threats that we determined were needed to be incorporated into our testing standards. Additionally, as I said, protective equipment standards are constantly evolving. And one of those drivers is, frankly, we have a lot more female officers now in law enforcement, and we hope to have even more in the coming years. Well, there are some significant differences between male and female body armor and how that is designed. And there are some things that we need to look at in terms of making sure that female body armor provides the same level of protection as male body armor. And then additionally, enhanced and expanded hard armor test methods. So coming back to ASTM and the expanded incorporation of these ASTM test methods, NIJ has partnered with ASTM International, or the former American Society of Testing and Materials, for more than a decade now. And the idea behind that is that in previous editions of the NIJ body armor standard, there was a lot of minutia in those standards as in terms of how test laboratories would go about calibrating and setting up the equipment that they used in their particular laboratories to do the actual testing. And the problem with that is, we talk about the advancements in technology and testing methods and what we learn over the years. Obviously the NIJ standard wasn't keeping pace with that. With ASTM, ASTM covers all varieties of industries. They have a number of standards. For example, in the construction trades and industries dealing with strength of steel or strength of concrete in construction projects and things of that sort. And they have a very established process to develop standards and to keep standards maintained and updated. They have open committees that work on these constantly, and they have a requirement that every single ASTM standard has to be revised and updated every 5 years. So by taking a lot of this minutia out of the NIJ standard and turning them into ASTM standards, it's just a more healthy ecosystem and ensuring that NIJ is keeping abreast with the latest developments in technology. And some of these standards, talk about, again, calibration methods for ballistic range equipment, the light screens that are used to measure the velocity of the bullets that are fired at the body armor. We test body armor on blocks filled with modeling clay. And that's not because it's a torso simulant, but it's a measurement tool because we're not only measuring, we're looking at, not only does a bullet, we don't want the bullet penetrating the body armor, but there's a lot of impact force when that bullet hits that body armor that gets transmitted into the human body. And we want to make sure that body armor is designed sufficiently to absorb and dissipate that impact force and not cause a life-threatening or fatal injury from what we call blunt trauma. So again, how you calibrate those clay blocks and make sure that they are consistent and measuring things consistently. So again, these test methods are very important and really an important part of what we're doing with these standards. The second part is the restructuring of the threat level matrix in body armor. If anybody's familiar with the NIJ standard for body armor and you hear about threat levels, you think of Roman numerals. Level 2A, level 2, level 3A, level 3, level 4. And sometimes that's a little confusing because it doesn't necessarily track sequentially from lowest to highest protection level. And what you see here on the screen in 06 on the left-hand side, what you actually see from top to bottom is lowest to highest level of soft armor, concealable armor protection. One of the things that we did in moving forward with 07 is we did a baseline study of the samples that came or the models that have come through the testing program in recent years. And one of the things that jumped out at us right away was level 2A armor has practically disappeared. Very few models are being tested to 2A. Well, why is that? Frankly, because law enforcement isn't specifying it anymore. Because if law enforcement was purchasing that armor, I can guarantee you manufacturers would be making it. So we took a look at that and we said, well, maybe this is something that it's not really reflective of where the protection needs are in the law enforcement community right now. So the performer protection level 2A is now omitted and no longer in the standard. So what you see in 07 is that the Roman numeral system has went away. And what you now see is for soft armor, and it is NIJ HG or handgun threat 1 and NIJ handgun threat 2. And those correspond to the former level 2s and level 3A concealable armor threats. And they're pretty much the exact same thing with the exception in the level 3A armor, the 357 SIG total metal jacket was replaced by the high velocity 9mm, which is a more common threat that we're seeing in law enforcement these days. The biggest change in the threat level classifications came in hard armor. So in hard armor in the 06 standard, you had level 3 and you had level 4. Now we have 3 distinct levels, and you have NIJ RF or Rifle 1, NIJ Rifle 2, and NIJ Rifle 3. Rifle 1 corresponds to the former level 3, which was the 7.62 NATO ball. But additionally, we've incorporated a couple other variants of that into that classification level because these are threats that law enforcement said that they've been seeing on the street. Additionally, and then jumping up to level 4 was a huge jump because that was your 30 caliber hard armor piercing steel core round. So, I mean, this is, a pretty high level of protection. Um, in talking to the law enforcement practitioners on the community, we're seeing a lot of emerging threats coming out of a lot of these semi-automatic weapons that are becoming more popular. And it actually sits in the threat level matrix between the old level 3 and old level 4. So we now have our NIJ Rifle 2, which covers some of those threats, the 7.62 millimeter and 5.56 millimeter threats that law enforcement is seeing. And then NIJ Rifle 3 is basically the equivalent of the old level 4. Additionally, talking about the differences with female armor, in making female armor, manufacturers have to incorporate a lot of design features such as folds, darts, seams, and things like that, which potentially can cause gaps or weak areas in the armor. And so that's one of the things that we want to be able to evaluate when we test the armor to make sure that, the armor is constructed in such a way that it's providing consistent protection across the entire surface of the armor. Additionally, we talked a little bit about hard armor testing. Again, enhancing the different types of threats that hard armor is evaluated against and how we measure that. And you can see some of the zones that we use in evaluating that armor. Additionally, another type of armor that we've seen develop more in recent years is what we call multi-curve armor. So it basically bends, left to right and top to bottom. And this actually came out of some military testing that we were made aware of, that in these types of plates, that what we call the crown, or where that apex is, where those two curves meet, could potentially be a weak spot in the armor. So we actually designed a test to specifically exploit that on this type of armor. Additionally, up until this point, all of the shots placed on hard armor were straight on, or what we call 0-degree obliquity impacts. In our soft armor testing, we do both. We do straight on armor shots, and we also do 30-degree angle shots. And we decided that it was time, based on some research that was done, to incorporate angled shots into hard armor as well. We have to be careful with that, because with hard armor, it introduces some ricochet effects and things of that sort that we have to be mindful of. And that's what you see on one of these diagrams. I tried to fix it, but didn't do too well. Where actually the original diagram showed that we were evaluating not only inward curves toward the center mass, but we were also looking at angled shots going out away on the edge of the armor. And doing our lead up research to publishing the standard, we found that introduced, again, because of this ricochet effect, some interesting dynamics that would be problematic in laboratory testing, or could, possibly be speculative as to, what exactly, calling balls and strikes, what exactly is a pass or what exactly is a fail. So we've now changed that, and all of the new angled shots are inboard towards center mass. So, okay. That is a real quick fire hose overview of what we've done in updating NIJ standards. Again, I'm available here today and tomorrow. Be glad to talk to you if you have additional questions. We also have some contact information here for our compliance testing team and our NIJ partners in this, if you have questions for them as well. So again, I thank you for your time and attention.
Thank you to each of our panelists. Elise, do we have time for questions?
I think we're going to do about 5 minutes for questions. So we'll see if we have any from the audience first.
All right, how about Merritt and Aaron? Can you talk to us a little bit about how you would go about gaining buy-in from agency leadership and also officers to participate in a program like NCRAI?
So is the question about participating in the evaluation or in the program specifically? Evaluation. So we actually discussed that at length when we first thought up the project, and there were a few key pieces there. On the law enforcement leadership side, we just had them involved from the beginning. Aaron did groundwork with the leadership of the different agencies, told them about the project, got them excited about it. We started meeting with them within the first few weeks of the project starting. I'll hand this over to you in just 1 second to give more details on that. The other piece, of course, was the officer buy-in, which in a lot of ways is a bit tougher because folks might be concerned about participating in interviews or in focus groups where the topic is so sensitive. So again, here we had a lot of groundwork done by Aaron, by the peer network, champions within the agencies and really just talking about how important it was to them, for their own wellness, for their coworkers' wellness, for their families, to have their voices be heard. And Aaron, you can talk a little bit about how you did that.
No, I mean, I agree with you. I think that was the approach, and it was basically going to people, our own peers and the people that trust us, and just explaining full out exactly what we needed to do and what we were trying to build out and what we were trying to find out. Letting them know that, hey, the resources are still here. We want to make them better, but we want to hear from you. What do you want to see that's better? How can we do it? But it was, again, leaning on that relationship, that ethos that we had with these folks, so that they would, come along and help us.
Oh, this is not working. Are there any other questions online?
We do not have any online questions. If you, any questions, we have a question in the back. And my only ask is if you use the mic, hold it as close to your mouth with being sanitary as possible. It's hard to pick up.
How were you able to overcome the in-house stigma of seeking mental health, with officers having a concern that it would affect them going further into their career?
Well, again, I don't know if this is working, so I'm going to do the best I can. So it took a one-on-one. It took one-on-one with that peer, explaining to what the process was, what that process looks like. And then maybe having some of those other peers who have been through that and did not have to deal with that stigma or live through that same fear, but saw it on the other side. The reason why this stuff works so well, and the reason why your work works so well, is even those guys that I was talking to you about before that went into those 30-day facilities, man, they are out and they're going around telling their story. So if I've got somebody who's struggling, somebody who needs something, I can say, hey, I got somebody you can talk to who's had to go through the exact same process. Can you see them? And then they get to see that real live vision of, well, man, I've known him for a while. I didn't even know I didn't know he was struggling. I didn't know he had to get that help. And now I see them getting promoted and advancing through the program. But again, it's it's a culture shift. And within every agency, I think you'll agree, there's different cultures within that agency, right? And so it's each agency that's going to have to make the decision, how serious are we about taking care of our people? And then seeing success stories, like he said, seeing a chief who responds, seeing a colonel who responds to somebody who is struggling, and it did not affect them. They were able to get the help. They're still active. They're still doing well. Then you're going to find that people will say, man, they're really taking care of us, which I think if you look granularly, it's going to help with retention. It's going to help with recruiting. It's going to help with those things. People don't come into law enforcement because of the money. Stay because of the purpose. And they want to stay and they want to come to it because they believe in the mission and how that mission is going to take care of them when they get into something. Is that fair enough? Yes, sir.
Any additional questions? We asked you use the mic just so our panelists can hear you and our online audience can hear as well. Thank you.
And so I'll tell you this, you're right, there is a strain, and a lot of that is because of what they're going through. And we know that can not only just the current situations, but if you're struggling personally, it's going to exacerbate all those other thoughts and feelings. I can tell you at my 5-year mark, I was like, man, I need to leave. This was what I dreamed would be. People don't want me to help them. And then at my 10th mark, I was like, well, it's too late. I've been here for 2 years. And then at my 15, I was like, I can gut it out. Right. And so, but that is what I was talking about. And that strength and that courage, it is not only going to take from the officer on the ground, but it's going to take from leadership and command to understand, because we have to answer those hard questions. And each of those questions is going to be answered differently depending upon the culture of where they're at. Right. But what we are saying, what Merritt and I are saying, is understand that the resources are there and they're not alone. And then there's another hurdle of getting HR and getting command to understand that bringing these resources in isn't going to make people leave. Some people may, but it's going to help and strengthen the people that you have. And if you can strengthen those resources within your own department and take care of those people, then maybe that morale will shift. Maybe that change of, maybe I don't need to leave. Maybe there's more I can do here.
Yeah, and the other thing that we're talking about here, we got to focus on the needs of our officers. There's no question about that. And we're trying to move in that direction. We've also got to realize that we need to meet the needs of those family members. I've got several officers, even in my old department, that have come in and said, you know what? The stressors that are affecting me are affecting my wife, my kids, my husband, whoever. And I've got an ultimatum now. It's me or your career. And how do I, as a chief, respond to that? Again, so we've got to provide those resources for not only that officer and make them trust those resources, that we are there for them. Again, these early warning systems, these programs aren't there to discipline that officer, but we're there to save their career and hopefully advance their career. Career development is very, very important for officers. Can I affect what they're hearing in the media or, no? But we've got to focus on the internal issues, not only with that officer, but now with that officer's family. It's in the past 4 years, it's amazing the number of people that have left the profession because family has said, I don't want you doing this anymore. And, again, that's kind of like that student that said, Chief, I would love to be in law enforcement, but my family will no longer speak to me. That's a dagger in my heart as a 40-year cop. So we've got to make it an all-encompassing program. And again, we can't control those outside stressors. We can control what we can do internally. And going back to what Julia said, when we do these agency assessments, we want to put fair and consistent policies and procedures in place so that cop feels like he or she is getting a fair deal within your agency. But unfortunately, now I had a phone call from a chief on the way here and said, we followed policy, we followed procedure, and went to our human resources. We did everything right, but my boss called me in and said, reverse it. So now how does that chief go back to his cops and say, it wasn't me, it was that guy. He's not going to be chief long. So, and that goes for not only disciplinary procedure, but also promotional procedure. We've got this great list. We've done it right. We've got the process in place. The bosses come back and say, no, this one needs to go here. This one needs to go here. This one. How do you maintain that morale within your agency when they're being told? And of course, the cops don't know that's what's going on. But to answer your question, we've got to do everything for our cops and for their families now to keep them in the profession.
And we do have trained spouse peers as well to meet those needs.
All right. I don't see any other hands in the room. So we're going to go ahead and break for lunch. A big thank you again to our panelists, Julia, Merritt, Aaron, Bill, and Lance. We definitely appreciate the information you shared today.